Everyone, this is Jane with Barlow Herbal, and we got Dr. Brandon Nielsen here. We are in the starting of cold and flu season for 2018-2019, and we wanted to give you guys some information, expand on some information that we talked about in a previous video on how to dose little kids, adults, how to dose the tinctures. But one of the questions that I get almost daily this time of year is specific questions on how to date or how to dose for
How to date.
how to date. We were just talking about
How to date.
we're just talking about
How to date your spouse.
how to date your spouse
Yeah.
and other things. But yeah, so how to dose. But basically, I realized that we didn't get specific enough. So we want to kind of expand on this. I recently got an email, actually just today, from a woman who has a 3-year-old with fluid in his ears, I think left over from an old cough, and a 6-month-old with a bad cough that she thinks might be turning into whooping cough. So these can be some serious issues. So let's address first the one with the fluid on his ears. Like, what would you do? Yeah.
As you want to go into dosing first?
Yeah, like however you want to start it.
I mean, you tell me about dosing, kind of what you guys, you know your remedies really well, and then I'll kind of talk about dosing, how I dose, and then I'll talk about fluid on the ears, and then let's talk about whooping cough.
Okay.
Or RSV or pneumonia for that matter.
Yeah, because those are scary issues.
They can be very scary, and you have to, for anybody who, if you even think it's starting to turn into any type of cough, like, do not hesitate. You have like a window. You've got to hit it hard. So with that being said, talk about dosing, and then I'll add my.
Yeah, so I raised both my kids on it, and they're in their 30s now. So
LDM meaning she's meaning LDM.
So yes, I meant LDM.
Immunity boost, right?
Immunity boost was not around.
Oh, that's right. But I mean LDM.
So the immunity boost has 25% LDM. So if that's all you have, but the nice thing is that there's all these other herbs that are supportive and help clear mucus out of the organs. That's even good and safe for little kids. So you can use one or the other. Normally, what I typically do is I suggest people go straight for the LDM if they suspect an acute infection that they want to go after hard. So if you only have the immunity boost, use that. But if you have the LDM, I would really suggest that you use a lomatium in tincture form first. For, say, example, a 6-month-old baby who's got a bad cough, who you suspect it is whooping cough or it could turn into whooping cough, I would, because their body weight's not very big, they really don't need that much. I would start as low as 5 drops, and I would do that 3 times a day. And I don't know if that's something you would agree with or if you'd go higher.
Yes, 5 drops. Or what I might do is go 6 drops, or I do 3 drops and do it 6 times a day. So sometimes when there's an acute infection, I will try to get that in as many times as possible. So imagine it's kind of like every time you give that dose, you're giving back a sword to the body. And then it starts to wear off, and it's kind of like give the sword back. So if a parent can dose more often, just like even sometimes when we're dosing, like my colloidal silver, the nasal spray, sometimes I'll have people do it like 12 times a day to knock out when they start getting a runny nose. But yeah, so the only thing differently on the dose, I'd say maybe go 3 drops and go 6 times a day. So it's more frequent. If you can't, then do like a 5 drop 3 times a day is sufficient. And I'll usually do it in a little bit of water.
Yeah, absolutely.
And then mom needs to be on it if she's nursing, especially.
Yeah. Well, and what I typically would do is I would say if there's not a marked difference in the next day, then I would literally double the dose or double the times that you're doing it. So keep it at 5 drops a day and do 6 or 7 times a day. But I even like the idea of doing more frequently during the day, especially to really go after something, because I love the analogy of here's your sword.
Yes.
Here's something to go after this, because we really need to look at our bodies and our immune systems as our soldiers. And if you don't arm them with something
that's exactly right.
to go after this, and that's what you're doing when you take an herbal tincture like LDM, which is lomatium. If you're watching this, you don't know what LDM is. So lomatium.
That's true.
Right?
So
we are
like,
also
what
familiar.
What are you talking about?
I know. So that, and I love too what you said in the other video about putting like something like unidogato or anything on the mastoid bone, because this spongy bone that lives right here behind your ear it will absorb very quickly. Absolutely. And it will move into the sinuses, it'll move into the nasal passages, and
so there's
really
a couple of things. So Yes, you can dose that, especially if you're noticing that they're having. So if you feel the lymph nodes, especially in kids, adults don't have the. So you have anterior, post, and then you have your posterior chain. So you have your SCM, sternocleidomastoid, and right there you'll have lymph nodes here, or you might call them glands. They're lymph nodes, okay? Anyway, so what you can use is the LDM directly right on this area of the neck or right here. So if you feel right behind the ear there, that little bony prominence, not the hole, not the dip, but the actual bony prominence, that's the mastoid bone. And so you can use the LDM, or you can use the una de gato, which is cat's claw.
Mm-hmm.
Or if you have essential oils, you guys, you can actually put Melaleuca oil, works really well. I'll put it right there. All of these three things, you can do all three of them. You're always going to end with the oil because oil is topical. Both the tinctures have the base of an alcohol. They'll go right into the skin immediately. That's how fast they go in. So it's awesome. Then you put on top, you put like the Melaleuca oil right on the lymph node. If you feel like any little BBs in there or kind of glands, swollen glands, put it right on that, and then put it on the mastoid, and then you'll put a little drop inside the ear, all right?
A little drop of the
Melaleuca oil.
oil. Okay.
Or you can even do a little drop of, have you guys ever used LDM in the ears?
Oh, yes. Yeah.
LDM in the ear or the una de gato in the ear, followed by the Melaleuca oil, okay?
Yeah, and it might feel kind of intense just because you're going to an ear canal. And especially if there's a little bit of infection in the ear, it might actually sting a little bit because of the alcohol.
It will. It will. So if that's the case, hold up. If they feel a little bit of sting, then you could use something not. You could use like a nano silver inside the ear, followed by the Melaleuca oil. Okay.
So let me ask you this: when you're
now this isn't for fluid behind the ears. You can do that. I'll tell you about that in just a moment.
Yeah. So besides Melaleuca oil,
Mm-hmm.
any essential oil, would you use it neat or would you add it to a carrier oil? So neat just means you use it plain, like straight on the skin, because a lot of essential oils shouldn't be used directly on the skin without a carrier oil. So how would you do that?
Depending on what the oil is, you need to be careful. So you can test it first on the skin, but I will go straight with Melaleuca oil.
Okay.
In fact, we just had a 7-year-old, 8-year-old that had that, and it just cleared up almost overnight. We used anyways, it cleared up very quickly.
Okay.
And you can go straight on skin. You can go neat, as she's saying. You don't have to use like a coconut. You don't have to dilute it through a coconut oil or an avocado oil. You can actually go straight on the skin with the Melaleuca oil. But if your child has sensitive skin, you can test it. A wrist is a good area to test oils because that's sensitive skin right here, or even the neck is sensitive skin.
Yeah, and even kind of like right underneath an
armpit.
armpit.
Right underneath an armpit is also sensitive, super sensitive. That really soft skin that never really sees daylight type area.
So those are really good places to test.
Okay, so that's dosing for like a 6-month, dosing for a 3-month.
3-year-old.
And then we'll talk about kind of swimmer's ear or surfer's ear or fluid behind the ears, what I call it.
Or fluid in the ears, yeah.
Let's talk about dosing for, no, it's not behind the ear, it's in the middle ear.
Okay.
So let's talk about dosing for a 3-year-old. Okay. And kind of toddler.
So, it depends on what it is for. If it's for you suspect a cold or flu-like symptoms, I would again just start really low because even though they have a
low as in how much?
Like 5 to 8 drops. You just don't need that much,
No, you don't.
And if the thing is, you can always increase it.
Right.
So add it to a little bit of water, add it to a little bit of juice if they're taste sensitive or they're really super picky and you can't get them to take it even in water. Mm-hmm. But don't add it to a whole bunch of water, don't fill up their sippy cup all the way full. Just give it to them a little bit.
Right.
And for a baby, and we talked about this in the other video, but it bears saying again, get a teaspoon, put the drops in the water, have a clean dropper that you can use just for this, and squeeze up the water with the LDM or the Immunity Boost in it, and squirt it in their mouth. Because most babies, like 6 months old, they might be drinking out of a sippy cup, but if they're not feeling good, they're not going to want to drink something that doesn't taste good.
Right.
Right. So you can get creative. You don't have to go, as parents, we use our intuition and we can get creative with how we give it to them. Yeah. Because Dr. Nielsen has four little kids.
Yes, we do.
Like little kids.
8 years old down to 5 months.
See, so
the other thing that I would do, for example, for my 5-month is I would actually put it on the bottom of her feet. LDM on the bottom of the feet besides mastoid. And so I'd use the dropper. That's one thing that we always try to have on hand is a dropper. If not, just the other day I just administered something to her and it wasn't in a dropper. It was a homeopathic and I crushed it up, put it in a little bit of water, 2 teaspoons. I crushed the pellet, put it in a little bit of water, and then I just gave her, because I didn't have a clean dropper, so I just gave it to her a little bit at a time in a teaspoon, and she was fine. She swallowed it down. Same type of thing. They're gonna gag a little bit with the LDM because it's like, ooh, bitter herbs. The other thing you can do is put it on the bottom of the feet. Excellent.
Yeah, and so do you just when you do, like, say you put it on the mastoid one, do you get a Q-tip, or do you just do the dropper and just kind of?
Take the dropper, either that or I'll put it on my thumb and I'll just put it along here and just,
Perfect.
yep.
Yeah.
And you can do a Q-tip, but
You don't need to.
no, I just,
Yeah.
now,
I know I've had people ask me that before.
one other thing, well, I won't go that far on this video. That's something that I would not tell you guys, but you,
Oh,
I know it's like,
wait,
no,
wait,
it's just,
geez.
I'm sorry. It's just like when you, okay, I'm not going to recommend this. Sometimes the thing, what I'll do with patients or with my children, I actually will swab the back of their mouth with a Q-tip, like with an oil, or else sometimes I'll even do a swipe on, so the ear canal comes running down, it comes into the throat, so behind the first pharyngeal arch, I'll actually swipe to open up that eustachian tube. Sorry, that's kind of going into fluid. Let's talk about that next.
Yeah, so let's talk about the fluid in the ear.
So anyway, so the 3-year-old, about 8 drops 3 times a day, or you can half that and do 6 times a day. All right, when it's really acute. If it's not, it's fine. Again, 8 drops a day should not be too
8
much of a
drops
problem.
several times a day.
You get into yes, and then you get up into more of the kid who's 8 years old, and you can do like 15 drops 3 times a day. 8 to 12 years old, depending on how much they weigh, and then into the adult, full dropper, full 3 times a day.
Yeah, so fluid or surfer's ear.
Okay, let's talk about swimmer's ear, surfer's ear. Fluid behind the ear, meaning in the middle ears. All right, one of the best things that you can do for that is get alcohol, rubbing alcohol, and what you'll do is just put a drop in there, let it soak in for about a minute or 2 minutes. You can actually put a cotton ball. The only reason why you put a cotton ball in there is so it doesn't fall out, okay? Now, alcohol, you're going to do that about 2, I would say a drop, 1 drop, about 2 times a day should be sufficient. So this is answering for the 3-year-old, okay? 1 drop, twice a day, depending on which ear. If it's both ears, you're going to do that both sides, all right? Now, the other thing you might consider is doing mullein garlic to help absorb that, but the alcohol should absorb that extra fluid. Then what we talked about earlier in the video, consider doing like a Melaleuca drop, consider doing it on the mastoid bone. One other thing besides the mullein and garlic drops, that's the biggest thing. And then sweeping the back of the pharyngeal arch. If you don't know how to do it, you can ask a doctor, like a naturopathic doctor, and you actually sweep that eustachian tube to be able to allow that to drain, okay? Hopefully that makes sense.
Yeah, and if you're going to put rubbing alcohol inside the ear to help it absorb the fluid,
it can dry out.
It can dry out.
Yes, it can.
And so what you need is something like a salve, like our golden salve natural.
Golden salve would be awesome to just rub in the ear.
Rub inside the ear, and that's going to help keep the ear canal moist, and you don't want to dry out the inside of the ear. So
right.
So yeah.
So that's very good. And again, the mullein, garlic, and then the last thing for the 6 months, starting to get possibly whooping cough or like RSV or pneumonia even. You guys, one of the absolute best things that you can do besides now the LDM or immunity boost that we've talked about is a nebulizer. You can go online, look at a nebulizer. You want to get a nebulizer with a face mask. Okay, so for 6 months, yes, you're going to do nebulizer. I recommend our nano silver. I do it for 6 month old, I do it for 3 month, I do it for 8 years old, and usually we can kick a cough that's almost going into whooping cough within about 24-48 hours.
Okay, so just explain for the people who don't know what a nebulizer is.
Okay, so a nebulizer, what it is, it's not like a vaporizer that uses heat to burn up the particles. A nebulizer, what it does is it has pressurized air, has a little bulb, and when that pressurized air goes through it, what it does is it blasts the particles into super small particles, so then you breathe those nebulized particles in, and it might cause you to cough a little bit, but it's like steam, it's like a mist, so you're breathing that in, and it's phenomenal. Like with autistic kids, ADHD kids, some people when they can't absorb, You can use the lungs as a route to absorb. Now, so anything for RSV, anything whooping cough, phenomenal, because now you're going directly with a nano silver, so it's not too much. You're not going to get too much down in the lungs. And what it does is actually goes down in the lungs and starts healing.
Yeah.
It's phenomenal. It really is.
And they're easy to purchase.
Yeah, absolutely.
You can just,
so get the nebulizer. If you need silver, we have silver.
And there'll be a link.
There'll
be a link. Yeah. There'll be a link below this about the nano silver that he has. It's the best, and it's the one I use.
It's phenomenal. Oh man, it's really amazing. The last thing I'll say with that, you guys, is if it really is whooping cough, I would use a no-sode, a homeopathic no-sode, to make sure that gets taken care of.
And what is that?
So
I know sometimes when you talk,
oh, man.
you know your stuff so well and you talk so fast. It's like, what the heck is that?
So pertussis, right? Whooping cough is pertussis, and you're going to use a specific homeopathic that is for pertussis that will actually help the body recognize that it's getting the pertussis and then actually eliminate the infection.
Okay, so what you're talking about, you recommend
is a specific that specific homeopathic
and what is it called?
I think it's called whooping cough or pertussis.
Was it the name of the company? Is that what you said?
No, the name of the company we use on that one, we use a company called Desbio. You can't buy it online.
No, but what's the name of the product?
Whooping cough, I think.
Oh,
or
okay,
pertussis.
Okay.
Yeah, I think it's called whooping
and
cough or pertussis.
And it's a homeopathic, and is that something people can get from you?
They can get from us. You'd have to call us. It's something that we don't really sell online because of the agreement we have with the company. But...
Okay. And then, so one more question before we end this. When you talk about mullein and garlic, is this, how are you, that to me is like, okay, where? I don't do mullein or garlic. I mean, I know what they are.
I know. I start telling you guys. I know. Thank you for reminding me.
So are they oils?
Mullein garlic, it's an oil. All it is it's an oil. Okay, it's not a tincture. Different tincture would be an alcohol. It's an oil. So all it is, you can get it. Do we have it? I don't think we have it in stock. You can go to a health food store and look for mullein, MULLEIN.
Yeah, it's a plant.
And they get it from the yellow flowering top. You can use that, and oftentimes they'll put it with garlic, and it's just an oil, and you'll drop that right in the ear. You put the alcohol first, or you put the nano silver, colloidal silver first, and then you always put oil on top, right?
Yeah.
So the mullein.
Yeah. Okay. So this is so funny that you would bring this up because one of my dad's original formulas he called Otex.
Yes.
OTEX.
That's mullein.
And that's mullein.
Or mullein, yeah.
And it's in an oil base that you put in your ear. I've actually had a few people who knew my dad from he's been gone for 21 years now. But they're like, when are you going to bring that Otex back?
Oh, see, now it's time.
So now it's time. Because honestly...
We were actually supposed to do our product this year of that, and we didn't harvest mullein. We got too busy.
I know, we the same. Sometimes it's just too much.
Like, it is what it is.
Anyway, I hope this has been helpful because this is something that I know I personally get a lot of questions about. And I've been just giving people the video on dosing, but it was kind of meant to be for you to come by today to do this video because I really feel like this is valuable information.
Here's the thing, you guys. Remember, this is a food. This is a plant source. So remember, you don't eat once a day. You eat often. If you're hungry and if the body needs food, you give it food more often.
Right.
You got to give that sword, or if it's a shield, you've got to give that to the body so that it can heal. It's the body that heals itself, okay?
Right. It's really
and don't be scared. You guys, don't be scared. This is natural medicine. Don't be scared, all right? And if you have any questions and comments, of course, let us know.
Yeah, thanks. That was really great information. If you guys do have questions, let us know. Give us a thumbs up and look at the links below if you want to contact this guy. So.
Oh, yeah, that's true, because some of those things you can't get unless you do call our office.
Yeah. So have a great day, guys, and we'll talk to you soon.